Good morning. This is Dr. Tarek. Another practice test for phlebotomy state examination. Blood collected in a red stopper tube may be used for most coagulation tests, will not clot, yield plasma and cell, yield serum and clotted red cell. The answer is D. Yield serum and clotted red cell. Proper finger puncture technique includes all of the following except avoid squeezing or vigorously massaging, puncture parallel to the whorls of the fingerprint, puncture the middle or ring finger, wipe away the first drop of blood. The answer is B. Puncture parallel to the whorls of the fingerprint. If a blood collection site continues to bleed after 5 minutes, bandage the site and tell the patient to hold pressure over the bandage. Notify the patient's physician or nurse. Wrap or pressure bandage around the site, none of the above. The answer is B. Notify the patient's physician or nurse. The following have all been ordered at the same time on different inpatients. There is only one phlebotomist on duty. Which test should the phlebotomist collect first? ASAP CBC in oncology, hemoglobin in labor and delivery, timed blood culture in ICU, stat electrolytes in the emergency room. The answer is D. Stat electrolytes in the emergency should be collected first. Which of the following analyte is significantly increased in the blood with changes in position? Iron, cortisol, glucose, testosterone. The answer is A. Iron. Which of the following is true concerning skin puncture on an infant compared with the dorsal hand venipuncture procedure? It is less stressful for the infant. There is less dilution of the specimen with tissue fluid. Hemolysis occurs more oftenly. Fewer punctures are required. The answer is C. Hemolysis occur more often. Which instance could an electric shock to a patient most likely occur? Drawing a patient's blood during an electric storm, drawing a patient's blood while standing in a puddle of water, drawing blood from a patient who is talking on the telephone, touching electric equipment while drawing a patient's blood. The answer is D. Touching electrical equipment while drawing a patient's blood. If a blood collection site continues to bleed after 5 minutes, bandage the site and tell the patient to hold pressure over the bandage. Notify the patient's physician or nurse. Wrap a pressure bandage round the site. None of the above. The answer is B. Notify the patient's physician or nurse. What is the proper way to dispose of laboratory specimen and contaminated supplies other than sharps while following BSI? Double bag and throw in the trash. Place in labeled biohazard bag or containers. Place in puncture resistant containers. Throw in the trash to be incinerated. The answer is B. Place in labeled biohazard bag or containers. A phlebotomist is asked to collect a hemoglobin on a patient in intensive care unit. There is an IV in the patient's left arm. There is no suitable antecubital vein or hand vein in the right arm. What should a phlebotomist do? Ask another phlebotomist to collect the specimen. Attempt to draw a blood from hand vein below the IV. Collect the specimen by skin puncture of a finger of the right hand. Collect the specimen from an ankle vein. The answer is C. Collect the specimen by skin puncture of a finger of the right hand. This is all for this video. Please subscribe my channel and like my videos. Have a good day. Bye.